My name is Nithya Priya Shankar, and I will be talking about my research project that was completed under the guidance of Dr. Suneja at the Cardiology Center of Houston. My project is titled How to Listen to Your Heart and focuses on the pulse test. Coronary artery disease is a very common heart disease that affects approximately 15 million Americans right now. Coronary artery disease is usually caused by plaque buildup, and the first sign of coronary artery disease is a heart attack. Plaque consists of cholesterol and other substances that will build up in the arteries of a cardiovascular system, and this will cause a complete or near complete blockage of the arteries. 70% of people who had a cardiac event were within normal guidelines for their lipid levels. Therefore, there was a need for a new test to be designed that will allow us to determine the patient's risk for a cardiac event within the next 5 years. This test was the Pulse Cardiac Test, which was designed by GD Biosciences. The Pulse Cardiac Test is a blood test that measures the body's immune response to endothelial damage. It does this by measuring protein leakage from unstable lesions. These protein biochemical markers are many. They include HGF, eotaxin, and MCP3, all of which act as chemoattractants for white blood cells to inflammation sites. CTAC, IL-16, and Fas ligand activate T cells and monocytes so that they can help at inflammation sites. HDL, HbA1c, and SFAS will trigger cell death pathways that will help clear the body of the immune cells. All of these are related to inflammation sites, which is what is typically present when there is arterial blockage. Therefore, all of these indicate the patient's risk of a cardiac event. The patient's score of each of these biochemical markers is measured against the national average of other people their age, and therefore patients who have a higher score than the normal are shown to have a higher risk of having a cardiac event. However, treatment is not prescribed based on simply the pulse test. The doctors will also take into account the patient's calcium score and whether the patient presents with any of the 7 indicators of cardiovascular disease. These 7 indicators include edema, which is swelling, syncope, which is random bouts of unconsciousness, orthopnea, which causes shortness of breath when the patient is lying flat, dyspnea, which is shortness of breath during strenuous activity, chest pain, shortness of breath, or palpitations. If the patient presents with an indicator of cardiovascular disease, a high pulse score, and a high calcium score, then they are immediately put on Plavix, which is a blood thinner that will help clear up arterial blockage caused by plaque buildup. If the patient simply presents with a high pulse score, then they are typically recommended to increase their water intake, reduce caffeine intake and stress levels, and also increase their physical exercise, all of which will help reduce the patient's risk of a cardiac event within the next 5 years. Thank you for listening to my presentation.